All right, welcome everyone. This is Sami Inkinen, CEO and founder of Virta Health, and I promise to start at 33, so it's 33, so let's get started. Looks like we have a full house, more than 100 people sign up to participate, so thank you for calling in. Before we get started, practicalities. If you have questions during the webinar, which would be wonderful, you can ask those questions in two different ways. You can either use the Q&A in Zoom and just write your question, and I will see and I'll try to answer it along the way. Or you can email Jessica, Jessica, @virtahealth.com, and your question will pop up here in our inbox. So let's get started. Well, first of all, this is the Virta Health webinar, and just to set the context, what is Virta? Virta is the first treatment to reverse type 2 diabetes sustainably without medications or surgery. Reversing type 2 diabetes is completely different from managing type 2 diabetes. We will go into the details shortly. But the transformative thing that we've delivered at Virta is that we can fundamentally reverse the disease and get patients off of medications, which of course translates into substantial cost savings, whether you're an employer or health plan. I have roughly 3 sections in these presentations. One, I will talk about a little bit of my personal background, and then the diabetes epidemic very briefly. And 2, we will discuss the clinically proven and published results and outcomes of the Virta treatment. And then the last section is about the product and partnership options that we have when we work with employers and health plans throughout the country. So a little bit about my background. Again, my name is Sami Inkinen, and I'm the CEO and co-founder of Virta Health. An immigrant to America, came to America in 2003 and started a company called Trulia, which is now called Zillow, 2004. So if you're into real estate, you may have used the service. The reason for me starting Virta is partially in this wonderful picture of myself winning a triathlon. In fact, I won the Triathlon World Championships in my age group a few years ago. And the reason for this triathlon story is that it was shocking, at least to me, that I also found out that I was pre-diabetic. And it was shocking because what we, on a societal level, tell people to do to avoid pre-diabetes or type 2 diabetes is to exercise more and eat healthier to lose weight to avoid diabetes, type 2 diabetes specifically. And I thought, this should not be happening to me. And as I was researching why this is the case, how is this possible, I discovered 3 things that really led me to found Virta with a group of scientists. And the things that I discovered was, 1, it is actually not obesity that causes type 2 diabetes, but insulin resistance. And it turns out you can be very insulin resistant and skinny. And I guess I was one of those people. 2, insulin resistance, and therefore the entire disease of type 2 diabetes, actually could be reversed without surgery or new pharmaceuticals by using a tool called nutritional ketosis to reverse this underlying condition. And then 3, which was exciting for me as a technologist, was delivering this type of treatment would be impossible unless you had a physician continuously supporting and monitoring the patient. And I realized at that point in 2014 that this would be possible because everyone is carrying a smartphone in their pocket and the telemedicine laws had changed. So we could, in fact, have a physician, a licensed doctor, to remotely monitor and help patients. So those were some of the discoveries for me personally that led me to team up with a group of scientists from Stanford and Harvard and MIT to start Virta 2014. So that's a little bit about my background. Now let's talk about the diabetes epidemic. So it turns out I wasn't alone with pre-diabetes or type 2 diabetes. This may not be surprising to many of you calling in. Today in America, 40% or 4 in 10 have pre-diabetes. In other words, what I had. And then another 1 in 7, about 14%, have full-blown type 2 diabetes. So if you do the quick math, 38 plus 14, more than half of Americans have either type 2 diabetes or pre-diabetes. This is a ridiculously shocking number. How is this possible? More than half of the Americans are suffering from this disease. And conventional wisdom was, well, we become lazier, we have too many cars, we don't walk, we become obese, we eat badly, and therefore half the population is suffering from this disease. But there were a few other things happening at the same time. So it turns out, starting from the late 70s, we very publicly demonized cholesterol and saturated fat. And here's a Time magazine cover of eggs and bacon, how it's really bad for you. And this really followed the 1977 dietary guidelines change for Americans, where effectively we said, if you avoid cholesterol, saturated fat, and eat a lot of grains and whole grains and cereals and juices, you will avoid heart disease. As a side effect, you can see here in a chart, this is the prevalence of diabetes and number of people with diabetes. This epidemic skyrocketed soon after these guidelines. And I should mention that without dating myself too much, I was born in the 70s, and I certainly lived through these 20 or 30 years when anything that had fat mentioned was unhealthy. And consequently, I personally, as an athlete, avoided fat at all costs. And if we look at this diabetes epidemic, the scale of it, so more than half of the people in America now have either pre-diabetes or type 2 diabetes. And that translates into just massively high costs. More than $300 billion is the total cost of type 2 diabetes now. For better or worse, depending on who you are, if you are a benefits leader at a company, a self-insured company, or if you're health plan, or if you're government, or if you're a taxpayer, you are paying those bills. And it's more than $300 billion a year per person. And despite our heavy efforts to manage and control this disease, it has obviously just gotten worse. And it hasn't only gotten worse because more people are having pre-diabetes or type 2 diabetes, but also the cost per patient has skyrocketed. And here's just one example. The sort of a last hope drug in diabetes is insulin. And what I have here on the chart is the last 20-year insulin unit cost. So you can see that insulin cost has increased more than 1,000% over the last 20 years. So not only we have way more people with diabetes, but also the cost of treating each individual has skyrocketed. And that's how we end up with more than a $300 billion problem each year. So this sounds pretty hopeless, and unfortunately somebody is paying these bills, either taxpayers, the government, or an employer, or health plan. Here's my question. Ask yourself, so we have this massive epidemic. What if you had a new treatment that could systematically take someone with type 2 diabetes, reverse the disease, get the person off of drugs, even insulin, which can cost $10, $20, $40, $50,000 a year per person. Reverse the disease and get on medications in a matter of weeks, and then sustain it for years, so it's not a short-term result. And on average, it save almost $10,000 in the first 24 months in medical costs. And you knew that this treatment would guarantee results. What would you do with it today? And there's a reason I'm asking this question, and it is a real question because that's precisely what we've done at Virta Health. Our treatment, as shown in our peer-reviewed results, we can reverse the disease. And there's a favorite quote of mine that Politico had when we published our peer-reviewed results, 1 year results, I should say, early this year. They said, these results, if you could deliver this, it would be the biggest drug blockbuster in history. And that's what we've done. Before I move into the actual numbers and results, let's watch a brief video about one Virta patient. And this is a couple of weeks ago, it came in an ABC channel in Indiana, they covered this patient, Pat, who got the Virta treatment for free because his spouse works for Purdue University, and Purdue is one of the self-insured company partners of Virta. So let me play this video, and this is about 2-3 minutes, and then we'll continue.
The CDC reports that 100 million people in the U.S. are living with type 2 diabetes or prediabetes. Groups in Indiana are working with Virta Health to reverse the disease, and they are seeing some success with a special diet. Our Aaron Lish working for you this morning to find out what's being done. Aaron, good morning.
Good morning. Virta Health is actually working here in Indiana trying to reverse diabetes. We have one of the patients here, Pat Bailey, here with us. Now, we've been talking. You are off insulin now. You've been on the program for 110 days, and you were talking about a special app that you have. Can you just show us exactly what it is and how it works and how it's helped you?
Sure. The app is it's online. It's live. So basically, what they're asking for me is for daily measurements of weight, blood pressure, my glucose, ketones, and as we go through the thing, you see that the numbers, and those numbers are going right back to my health coach and right back to the online endocrinologist who monitor my daily activities. It's one of the things I really like about this program is because you've got constant support. You've got something that you're being kind of tied to the numbers, and I think that's probably one of the reasons why I've been so successful is because I kind of have this game with myself that I like to beat the numbers. I mean, I did it probably when I was taking insulin, and now that I'm off, I get excited about seeing a low number or a number in range because it means I'm doing the things I'm supposed to do to reverse this and make myself better for the future.
You were saying they look at the numbers, but they also ask you how you're feeling that day. They have the community that you can work with too on your app and everything. How has that worked for you?
Well, it's been great because I'm talking to somebody live as a health coach as I need them. So questions about a diet, questions about some kind of food that maybe I should or should not be eating, those questions are answered. The community's been great because it's kind of like the Facebook of community for Virta because it's people that are going through the same thing as I'm going through. So somebody finds a best practice, a best recipe, a best way to do something. You've got that access. I mean, the power in numbers is incredible.
And my last question I had to ask you, we're talking about how much this all costs. How much do you think this has ended up saving you?
It's saving me a couple $100 a month easy. I know it is. Just in supplies and insulin and co-pays and things like that. And so that starts to add up long term.
All right. Thank you so much. If you'd like to look into Virta Health and how this can work for you, we have that on the IndyChannel.com under the Hot Button tab. I'll send it back to you in the studio.
All right. So that was Pat, one of the Virta patients, and I saw here a question coming in from one of you. Can you define what type 2 diabetes reversal means? Well, thank you for that question. And in fact, in this news clip, they talked about type 2 diabetes reversal. So it's really two things fundamentally. One, we will get a person's blood sugar into a non-diabetic range. And two, achieve that by simultaneously getting the patients off of diabetes medications. In other words, a person is back to where they were normally before type 2 diabetes, normal blood sugars and no diabetes medications. So it's very different from diabetes care or diabetes management, where patients are pumped full of drugs to try to keep the blood sugar low, which of course increases costs and doesn't cure or reverse the disease. So thank you for that question. Before we go into the actual clinical trial results, one final thing. When I was starting Virta and did the initial rounds with health plans and employers and meeting with chief medical officers and benefits leaders and mentioned that, hey, we're starting a company to finally try to solve this diabetes epidemic, most people started rolling their eyes immediately and asking me questions or giving reasons why trying to do anything in diabetes doesn't really make any sense. So I wanted to address a few things here up front. Question one that I got was, wait a second, disease management, diabetes management has existed for a couple of decades, and at least every chief medical officer of health plan said, to be honest, you look at the numbers, it has delivered zero ROI, it hasn't worked. That's completely true. Epidemic has just gotten worse. But the fundamental difference with what Virta does is we don't just try to manage patients, we reverse the disease, which saves lives and saves money. So we're very different. So that's the first point. Second question, we talk about results, we talk about clinical trial results, but I got this comment, wait a second. Every healthcare company claims that they have proven clinical results. That unfortunately is true as well. What we try to highlight is that we've actually run a clinical trial. We've actually published peer-reviewed results in peer-reviewed publications. There's a difference, huge difference between publishing pilot results or publishing results internally from company data. Third question was around ROI. There really isn't an ROI in disease management. We agree, again, you have to reverse the disease to actually save money. In addition to that, we decided to align the Virta business model with the results since the very beginning. And what that means in practice is we put 100% of our fees at risk. So if we don't deliver results, we don't get paid on an individual patient level. And I'll explain in a few minutes how the savings add up, and they total almost $10,000 per patient in the first 24 months. The next question I got was, well, maybe you have a magic pill, but trust me, in our population, we can't activate anyone to do anything. We thought that was a challenge, but what we've now seen is that in targeted populations that we work with, commercial populations, we can activate about 30% of those patients in under 12 months. And when I say activate, it actually means that these members or employees become patients of Virta treatment. The next question I got, well, maybe you can activate, maybe it works, and especially after we publish our short-term results, but what matters is 1 or 2 year results. That's true. And so we've now published 1 year results with north of 80% retention, and we now have data past 3 years. Our 2 year peer-reviewed results will be coming out this year. So what we do is sustainable, and the results sustain themselves. The next question was, well, maybe it's great, maybe it works long-term, but my healthcare costs are growing 5 to 8% year over year. I can't add anything else there. Our response to that is, we don't want to add anything. You have to have an ROI in the first 12 months, and we deliver that. In addition to that, the way Virta gets paid is really through claims. So we eliminate existing claims and then get paid less than the savings. And typically, when we work with an employer, we work with the TPA, the health plan that administers the plan. So there's really no additional logistical contract or budgeting complexities from the employer's perspective. So those were some of the questions I got early on, or reasons why we should not start Virta, but here we are, started the company. 3-4 years later, we have now clinically proven and peer-reviewed results to show what we've delivered, and we've also delivered the same in commercial populations. So let's jump into the results. First, without going into details, we've now published 3 peer-reviewed papers in peer-reviewed publications, and we have 4th one in peer review as we speak. And so the results that I will be showing, I will highlight what's peer-reviewed and what's not, and most of it is already published. Highlight figures. So if there's only 1 or 2 things to remember from our results, what the Virta treatment has delivered now at the population level in a clinical trial, and we've replicated the same results in commercials, is number one number to remember is we've reversed type 2 diabetes at about 60% of our patients at 1 year, which compares to about 0% in standard of care. Second important point, while we reverse type 2 diabetes, we also improve cardiovascular risk. This is also 1 year data point. So we reduce cardiovascular risk by 12%. So we are not a point solution for type 2 diabetes only, but we also either eliminate or improve other comorbidities. And I will detail those in a few minutes. And I would say the other point to really remember is when you reverse type 2 diabetes, it's very good business as well, because the cost savings are very substantial. So on a population level, in our clinical trial, this is peer-reviewed results as well, we eliminate almost 50%, so exactly 46% of diabetes medication costs. And when you tally up all the medical and pharma costs, it adds up to about $10,000 per patient in the first 24 months. So these are the high-level results from Virta clinical trial results. Again, these are all published and peer-reviewed, except the last one is our partially our analysis, the cost savings, but everything else has been published and peer-reviewed in publications. So let's go into detail. So what does diabetes reversal mean? It means dropping the blood sugar to a non-diabetic range and eliminating medications. This is from our clinical trial. You can see that average patient, or on average, the population started at 7.5. Rapid reduction in blood sugar A1C. Anything below 6.5 is under the diabetes limit. And the results further improved at 1 year. And at 1 year point, 60% of the patients had diabetes reversed. And if you compare to the standard of care, the picture is pretty bleak. Despite diabetes management, the blood sugar is basically flatlining. The other point to make when we talk about diabetes reversal, as I mentioned before, is it's not just about the blood sugar or A1C. You also have to be able to eliminate diabetes medications. So here's a chart that shows the annual cost of diabetes medications. So we reduced it almost by 50% on a population level in our clinical trial. And if you look at those patients who came on insulin, the insulin users' drug cost savings were more than $4,000 per patient per year. So this was from our clinical trial population. Now we've treated patients throughout the country in commercial populations. The picture is actually even more attractive from both from a cost and a patient perspective. That is, in commercial populations, the drug cost savings are even more dramatic. So it's about 71% of the total medication costs. And the reason I'm able to publish these and show these results is we actually have a formal registry for our commercial patients. So anyone who comes in, any patient, they can opt in to have their data used for research. And this is where this data is from. And there's a couple of things to really note here. One, the medication eliminations happen very, very quickly. So you can see the x-axis 50 days. In under 50 days, most of the reductions happen. And then the second point is these substantial savings persist. So you can see the data up to 1 year, and the costs just keep coming down. And again, this is not the total cost savings. This is just the medications. But the reason I highlight that is there are no other treatments out in the marketplace that reverses type 2 diabetes and gets patients off the medications. And these savings are also very, very easy to quantify. Weight loss, it is not our primary endpoint of focus, but it is a desired side effect positive side effect when insulin resistance is reversed. You can see here that the average weight loss is more than 12%, or about 32 pounds among our clinical trial patients. And secondly, in this chart, you can see that there is no bounce back at 30 days or 60 days or 90 days. Any intervention that produces weight loss out in the marketplace today, typically there's a bounce back that starts somewhere between 2 and 4 months, and then it regresses back to 0. And if you look at the magnitude of this weight loss, more than 80% of our patients lost more than the 5% of clinically significant weight loss. So do people stick to this, or is this data that I'm showing just cherry-picked few people who stay on a better treatment? The answer is yes. Our patients are highly engaged, and in our clinical trial, the retention was 83% at 1 year. So more than 4 out of 5 patients were still engaged and stayed as Virta patients. I don't have the chart here, but our commercial patient retention is actually higher. It's 92% at 1 year. So it's substantially higher than just taking a pill. and I'm looking at this. The question just came from one of your listeners. What percentage of enrolled patients stick with the treatment and whether or not they hit their objectives? So this slide really answers that question. It's 83% of our clinical trial patients, quote unquote, stick with the treatment. And in commercial patients, that's more than 90%. And do they hit their objectives? As you saw on the previous slides, blood sugar reduction, getting off the medications, and weight loss, yes, those results on average are amazing. And then, of course, there are patients who are even more successful than the average. What else happens when we reverse insulin resistance? I mentioned earlier that we reduce the total cardiovascular risk score by 12% at 1 year mark. The other chronic conditions that the Virta treatment improves is dyslipidemia, which really is behind heart disease. 60% of those who had a clinical definition of atherogenic dyslipidemia had it reversed. Those who had clinically defined elevated blood pressure, quarter of them had it reversed. And then those who had chronic inflammation as clinically defined, about 1/3 had it removed. So when you think about the Virta treatment, yes, we reverse type 2 diabetes, but the reason we can accomplish that is we reverse the underlying cause, insulin resistance. And when we do that, a bundle of other chronic conditions either get better or reversed. So it's really one treatment that addresses 3 or 4 chronic diseases, potentially even more as we do further research. So that concludes the section about our outcomes and the diabetes epidemic in general. And then we move to the second half of this presentation today, which first talks about a little bit of the patient experience, and then I'll explain how we work with health plans and employers today. So how is this all possible? When you become our patient, where does this magic come from? We basically deliver have delivered two types of innovation, which really enables us to do what we do today. And I will explain both. On this slide, on the left-hand side, I talk about continuous remote care and the technology platform that allows us to deliver remote physician-led care without actually touching the patient. So we call this continuous remote care. It's not just software, but we use software and technology to enable full-time and licensed Virta physicians to deliver care. And then the other part of the Virta IP is, of course, the protocols, like how do you reverse insulin resistance. So let's start and talk about the technology. What we provide to our patients and our customers is always about outcomes. It's not about features, because nobody really in healthcare should ultimately care about features. It's about the health outcomes and the economic impact. But I'll talk about the features here a little bit. The main idea is that we provide almost like an emergency room type of experience to our patients, but in an outpatient setting. And that is to say that we use a smartphone and computer and monitors and sensors to track number of biomarkers from our patients, whether that's blood ketones, blood pressure, blood glucose, different subjective markers. And then our clinical team, including our licensed doctors and our health coaches, analyze that data and decide what do we tell that patient. It might be, we'll reduce your insulin by 30 units tomorrow, or it might be related to nutrition, or it might be related to behavior change, so it might be problem-solving practical things. But the main idea is all of our patients feel like they have a physician in their pocket. And how we integrate this technology and our physicians with the existing primary care physicians is interesting, because we don't replace the PCPs. We are very much sort of a parallel, easy plug and play specialty medical practice. We are not a replacement for PCPs. We are not telemedicine that replaces the PCPs. We are a licensed specialty provider in all 50 states. We do the work that primary care physicians and endocrinologists don't have time or ability to do. And we are very additive to the primary care physician economics. So we do save a lot of money. That comes from hospitalization savings as well as medication eliminations, but we don't take work away from PCPs. And so especially if you're running a health plan, this is a question we typically get. What does my provider network think about that? Think about Virta. And they typically think about very positively. And then, of course, big part of our operations is to make sure that we seamlessly update the PCP of our patients, and we tell them how we've adjusted medications. But typically, as I have the last point here, we reverse type 2 diabetes in between primary care visits. So whether that's every 3 months or 6 months, the Virta treatment works so quickly that when the patient goes back to his or her PCP, the PCP is very surprised and say, wow, what happened? Your blood sugar is down 2 points into non-diabetic range and you're off of your diabetes medications. Whatever you're doing, keep doing it. That's the typical feedback we get. So that was a little bit about the technology platform and how we deliver a continuous remote care as a provider. Then you can have the most amazing apps and tools and things, but if you don't have the right protocol and science, you will not reverse type 2 diabetes. And we've developed all these protocols in-house based on decades of science by my co-founders, and then of course the published research and advancements that we made over the last 4 years. Primarily, our IP is around 2 areas. One is how to use nutritional ketosis to reverse insulin resistance, and then secondly, how do we manage medications remotely? So this is a complex and detailed chart, but basically what I'm showing here is we track number of biomarkers from each patient every day, and then software and our clinical team decides how do we guide the patient towards type 2 diabetes reversal. And the guidance is around nutrition, behavior change, medication adjustment, and sometimes even solving very practical issues like I'm traveling on airports, I don't have access to food that I usually have at home, what can I eat? How do I make sure that I don't get hungry or I eat the wrong thing? And all of this guidance would not be possible without software, but it also wouldn't be possible unless we had licensed physicians who can actually practice medicine and define and decide if we have to adjust medications. Nutritionally, you might wonder, what do the Virta patients eat? So here is a highlight of what's behind the nutrition science that we use to reverse insulin resistance. First point, there is no one size fits all. It's highly personalized. We have treated retired patients in the Midwest to white-collar workers in New York. We've had Southeast Asian Indians to Caucasians to African Americans and so forth. So you can imagine that if you are vegetarian by religion, we cannot tell you, well, at least we don't tell you to have bacon and eggs for breakfast and so forth. So it's highly personalized. Second point, however, the commonality is highly individualized carbohydrate restriction because that is the way to achieve this state of nutritional ketosis. Point 3, we don't sell shakes, we don't sell packaged foods. We are very focused on teaching the fishermen to fish, if you will. So it's more about education as opposed to delivering any kinds of food. Fourth point, which is a surprise to a lot of people, is our patients are not asked to restrict calories or stay hungry or even exercise. We teach our patients to eat to satiety and primarily based on real foods. And then the last point, the fifth point, when I mentioned that we restrict or eliminate, for the most part, cheap carbohydrates such as subsidized corn and sugar, people ask, well, this sounds like it's going to be very expensive for my members or for my patients. And the answer is, it actually isn't. We have had patients who've succeeded in food deserts or just simply eating on a fast food based diet. Not because we recommend it, but that might be the only food available for some of our patients. So it is possible to be a Virta patient and very successful in reversing type 2 diabetes without access to fresh, organic, and wonderful whole foods. So that's a little bit about the Virta treatment, how it works. And if there's only one thing you remember, I would say it is that we are a licensed medical provider with physicians in all 50 states, and we deliver a specific treatment 100% remotely. So let's talk about why does the Virta treatment matter from an economic perspective. First, as a kind of a proof point that it is not just good or the right decision for the patient, but we can also save a lot of money, is we launched publicly after 3 years in R&D and clinical trial just in early last year. And since then, we've signed and deployed now with several large employers and health plans throughout the country, also a Native American nation in Oklahoma. And we've treated an order of magnitude more patients than our clinical trial throughout the country so far. And here's an example of one of our customers, and enterprise partners, Purdue University, which was, I believe, was our second launch early 2017. So how do we work? What's the business model? Business model is, if we don't deliver results, we don't want to get paid. So we put 100% of our fees at risk based on outcomes, and we've made sure that there's a cash-on-cash ROI in under 12 months. If this doesn't happen, in fact, Virta shouldn't exist. There's a lot of things in healthcare where there are lots of claims, but when push comes to shove, people want a fixed fee for their services, and then they leave their enterprise partner, whether it's employer or health plan, to wonder whether there actually was an ROI. In our case, we want to make sure that you save money and lives at the same time in the first 12 months. So how much can we save? There are at least 6 categories where we can produce savings when we reverse type 2 diabetes. But all the numbers that I will show only include medications and medical costs. Anything related to productivity, workers' comp claims, and so forth would be additional savings depending on the workforce. So if you look at just medication costs and medical costs, based on our clinical trial patients, this is average. Again, this includes patients who are not successful and patients who are successful. In the first year, we save more than $4,000 on average. And in 2 years, it's almost $10,000 to be specific, $9,500 or so in the first 24 months. And the one thing I would add here is, given these average numbers, if you take patients who come in with insulin, which is about 1/3 of type 2 diabetics, the cost savings are way north of $15,000 in the first 24 months. These average numbers include type 2 diabetics who were more recently diagnosed, and they may be just on generic drugs like metformin. So those are the cost savings. How do we bill and how does Virta get paid? Typically with employers, the approach is pretty simple. We have one bundled fee that's tied to outcomes. It's one bundled fee per patient. It covers all the tools, all the strips, all the monitors, all our physicians' time, the Virta treatment, everything included in one single fee. And it's tied to specific outcomes so that we are 100% at risk to results. Logistically, typically we bill through the health plan TPA. So we've done security assessments and agreements with many of the large health plans throughout the country. So from an employer's perspective, the deployment is pretty flexible and easy. All you have to do is let us and your TPA know that you want to include the Virta treatment in your benefits plan, and we will go from there. And so we don't charge PMPM, PMPY fees. We only charge for per patient basis when we deliver results. Last point about commercial partnerships is the effectiveness of our enrollment. And I did mention this in passing in the very beginning, that we've been able to activate about 30% of eligibles in the first 12 months, which was a big positive surprise to me personally, at least. I was told many times that activating type 2 diabetics is notoriously very hard. But it turns out that when you tell someone who's been type 2 diabetic for 5 years, 10 years, 15, 20 years, and say, did you know that the disease could be reversed? Did you know that you could get off your medications perhaps in 30 to 60 days? Did you know you could get your energy back to do the things that you wanted to do and you used to do? And by the way, your employer health plan covers the cost of this. Lots of people raise their hand and say, oh my God, if that's true, I want to be part of it. Let's give it a try. So that's been really our experience. So I'm going to finish with this one brief summary, and then I'll open up for even more questions. I can see that there are a number of questions coming in. Point one, Virta is not business as usual in type 2 diabetes. We are not type 2 diabetes management company. We can reverse the disease, and it's fundamentally different, both from how do we do it, but more importantly from outcomes perspective than anything else before in type 2 diabetes. Point two, we are not a point solution for type 2 diabetes only. We improve or reverse 3 other chronic diseases. This is not a claim that I just make lightly. We published peer-reviewed results and can address at least 4 different diseases. Point 4, we are a provider. So we are a licensed provider with full-time Virta physicians in all 50 states. So we are a plug-and-play specialty provider as it relates to PCPs, and it also makes it very easy to work with us when we work with employers or health plans. We are open in all 50 states, so we've already done nationwide deployments. That means whether your workforce or your members are in a concentrated area or all over the country, we can help very quickly. And then lastly, we make pretty bold claims, most notably that we can reverse type 2 diabetes, but we also put our money where our mouth is. So if we don't deliver those results, we will go out of business. And it's obviously very attractive for the payer, the employer health plan, because there really is no economic downside. And we intend to keep it that way. And I personally hope that more and more of the US healthcare looks like that. Okay, so I am seeing questions coming in, so I'll try to answer these questions here as we go before we run out of time. So there was a question of what percentage of enrolled patients stick with the treatment. We already covered that, so it's 83% in a clinical trial and more than 90% in our commercial population. So that's at 1 year. So this is not a 3-month or 4-month thing, but at 1 year, and at 2 year, we haven't published those results, but they're still very high. And by the way, if you have more questions, just email Jessica, Jessica, Jessica @virtahealth.com. So you can email Jessica or just use the Zoom questions box. And then there's a question about the cost savings. Was this savings per patient versus their prior 2-year claims or comparison to some benchmark? Yeah, that's a very good question. So our savings was on a population level in the chart that I showed earlier. So this was relative to average population benchmark. So this analysis was not done on a claims by claims basis for each individual patient. So the 10,000 a year was not individual basis claims by claims. However, I do have something that on a patient by patient basis, and it is here, the medication cost reductions in our commercial population. For these, we have claims. So you can see that this goes from almost $5,000 to $1,000 on average, the diabetes medications alone within the first year. Related to this, there's a question that what percentage of the cost savings are from medications? It depends on what medications patients are, but roughly it's about half or so. If someone is on very costly medications like insulin, it can be even more, but it's roughly half. So here you can see these savings are about nearly $4,000 per patient average in medication costs alone. So the total savings, which I don't have here on the slide, it's likely about twice that per year. Then there's a question, does the Virta patient's physician, does the Virta physician stop the medication? Sorry, does the PCP stop the medication or your Virta clinical staff? What are the licenses you deploy in your staff? The answer is that the Virta physicians who practice medicine and adjust medications, they are MDs, licensed physicians in all the 50 states. So these are real doctors, and not that the school necessarily matters, but we've hired mostly people from Stanford Medical School, UCSF, Southern California. We have an endocrinologist from Johns Hopkins. So these are top of their field physicians, and they do make the decisions about the type 2 diabetes and related medications. So it is the Virta physicians who make that decision. And it's fundamentally necessary because these medication adjustments happen on a daily basis. So we would not be able to rely on the PCP to maybe do something a month later, but it has to happen on a real-time basis. And this is one of the reasons Virta is a licensed virtual medical clinic, not just a group of coaches and so forth. There's a question, does an incoming patient need to be type 2 diabetic or need to have an established diagnosis to become eligible? Can Virta assist in determining if someone is eligible? Very good question. We run very comprehensive labs for every single one of our incoming patients. So we know exactly if someone has type 2 diabetes coming in or not. The actual eligibility criteria from a commercial standpoint is defined by our partner. So we have employers who cover the Virta treatment for both pre-diabetics and type 2 diabetics. And then we have partners who only want to address the sickest and the costliest patients. So that decision, whether you have pre-diabetes or type 2 diabetes and whether you are eligible, is really determined by our partner. We take everyone that is covered by our partner, and then based on the lab work, we can tell precisely if you're a type 2 diabetic or not. Then I think there was a question, let's see, Spanish materials and staff available. Somewhat, so we do have Spanish-speaking coaches. Currently, right now, today, for 100% Spanish, we are not yet available. So we do have Spanish-speaking Virta clinical staff, but if a patient cannot understand any English, we would not feel comfortable doing that. How is Virta paid? Is it upfront 100% or piecewise? And how does that work? Most of our contracts include, well, first of all, I should say the Virta fees are 100% at risk. We will go 100% at risk, but for cash flow reasons, we do split the fee usually for some upfront and some at the end of the first year. What that means specifically is that when we enroll a patient, they've gone through the labs, they've had their first visits with our doctor, and we send them a bunch of tools, the Virta starter kit. At that point, we get some payment, and then at the end of the first year, depending on outcomes, the rest of the payment. That's typically the split. Let's see if there's other questions coming in. We'll run until 25, so we have 2 or 3 minutes to go here. And again, thank you so much, everyone, for calling in and joining. I don't have the exact number in front of me, but we had more than 100 who were originally supposed to sign up. There is a question, what is the long-term research on the health and safety of a ketogenic diet? That's a really good question because we do use nutritional ketosis as part of the Virta treatment. So yes, let me answer this in 2 ways. First of all, one, is Virta the same as ketogenic diet? No, Virta is not just a ketogenic diet. Virta is much more. And if you Google ketogenic diet, that is not the same as Virta treatment. So we need to be very clear that Virta treatment is different. And then 2, in terms of safety, our results are far superior for someone living with type 2 diabetes. We eliminate high blood sugar, we eliminate the drugs that are risky, we improve 3 or 4 other chronic conditions. So for 100% of our patients, their health status is much healthier and less riskier than when they are coming in. I'm not in a position to say, should the entire world be on a ketogenic diet, and is that a better option than some other diet? That's not what Virta is about. But we do have multi-year evidence that what Virta treatment delivers is much healthier than current type 2 diabetes management or medications. I will finish this presentation by mentioning a couple of things here before we sign off. Our next webinar is going to be co-hosted with one of our enterprise partners, US Foods. So during that webinar, we'll share some of those results and how we've rolled out nationwide and what's been the experience both by the US Food team members as well as for Virta. And that webinar is on September 14th. And if you can see my screen, you can see that there's a URL, a link where you can go to sign up for that. So that is on September 14th, a few weeks from now. And then also, if you happen to be an employer and attending the National Business Group on Health, NBGH conference in Atlanta, Georgia, September 26th, so about a month from now, we are there presenting with US Foods about our partnership and the results. So if you're interested in not just hearing me or somebody from Virta talk, fair, you probably enough of me, you can hear one of our enterprise partners to share their results and what are their experiences working with Virta and what kind of health outcomes and cost savings they've seen. So 2 options: you can either sign up for a webinar that we co-host with US Foods, or you can come and say hi or listen to the National Business Group on Health presentation in Atlanta, Georgia in about a month's time. And if you haven't been to the NBGH conference and you're an employer, you'll need benefits. I personally would highly recommend. I've been there for the last couple of years and it's always been insightful and there's a lot of best practices shared among employers. So I'm gonna hang out here for another minute, so 60 seconds, and then after that, we'll sign off. And while I wait to see if there are more questions coming in, just wanted to say thank you for dialing in. Thank you for calling in. I'm happy to have even one-on-one conversations afterwards. So let's see if I have my email address here. Feel free to send me an email, reach out to me. I'm never too busy to help current or potential future partners. So my email is Sami, S-A-M-I @virtahealth.com. Happy to answer any questions that you might have. And we'd be delighted to help you or your members or your employees to reverse type 2 diabetes, save lives and save money at the same time. All right, we'll finish the webinar at this time. Thank you so much for tuning in. And again, if you want to hear more about Virta and our results, the next 2 options are September 14th webinar with US Foods and then our presentation with US Foods at the National Business Group on Health conference in September 26th. So thank you so much. Have a great day.